My name is Lisa Hellwege. I'm Director of Earworx. I've been nursing for nearly 30 years. I have 6 adult children, 3 of my own and 3 I inherited with my partner Scott. While I was in ENT, I did a leadership and management course. And that was probably the thing that really turned things around for me in terms of my career and my entrepreneurship. In 2016, I started Earworx in Hobart. Earworx is a professional earwax removal service. So we remove earwax using a procedure called microsuction and curettage. So microsuction is like a little vacuum cleaner and curettage is like a little instrument, so a curette forceps. It's a dry technique. It's different to the traditional method of removing earwax. Most people have heard of having their ears syringed at the GPs or irrigated. That's not suitable for everyone, and it's certainly not without its complications. So we offer that dry and gentle alternative. It's our core business. So our nurses are all, they complete an extensive period of study and practical training to ensure they can learn how to work safely around the eardrum and develop their depth perception. We've now got 26 clinics operating across 5 states in Australia. My role at Earworx used to be to actually run the clinic. It was just me there day in, day out, which I loved, and that's where I developed a love of the service. There's no doubt we've had a positive effect for patients and the healthcare system in general. So we've got 23 clinics now across Australia. We've got over 35 RNs and support staff that represent the Earworx brand. So that's a pretty big team now. Our clinics free up around about 75,000 appointments each year for earwax removal that would otherwise have had to go through the GP, an ENT specialist, or even the hospital emergency department. So we've really reduced that burden on the wider healthcare system and on ENTs. It's difficult to get into an ENT these days by providing that safe and gentle alternative. Running a nurse-led clinic does come with its responsibilities. We're innovating, we're breaking the mould in terms of traditional models of nurses working under the supervision of medical staff. And this is why how we go about things is really important. It's about quality, it's about evidence-based practice, working within our scope of practice and not moving into somebody else's scope. It's about excellence, it's about extensive quality training, which includes that practical component for each of the nurses representing our brand. And then once you sort of set those standards, it's about not wavering. To me, I figure we've got one shot to show that nurses can work independently within their scope, and we don't want to muck that up. It's really, really important. If you're a nurse looking at changing a model of care or service, first of all, start looking at what you can find out about it. So having a look at the literature, perhaps even having a look at what's happening in other countries, talk with the relevant experts in your field. In my case, that was ENT surgeons, and I had a business consultant who was my partner, and work with them with your idea, the training and the education that might be required to see an RN deemed competent in that procedure, or what work needs to be done to reach that goal. If you're a nurse working on the front line and you're thinking, oh, I think maybe we could do something a little bit better here, again, just talking to your peers, having a talk to leadership within your unit, and being brave enough to just pitch your idea. So particularly if you've got some evidence behind you, you might go to the hospital library or get online to some databases, find some literature that supports your argument. Data is very big. So if you've got any data on anything, data talks. That's very powerful. If you can say, look, statistically, this is what we're seeing here, or I've noticed in the literature that in other countries, when they apply this model, we can actually get more patients through our unit, or whatever the case may be. As a nurse Trailblazer finalist, I'm just so excited, mostly because I can see that it's a platform to help others and to inspire other nurses. There's 337,000 us nurses across Australia. We're educated, we're a trusted profession, we're skilled, we're resourceful. I've shown through Earworx that you can achieve more than you think you can. If you're a nurse out there watching this right now and you have an idea to change your model of care or are thinking about working independently, just take that first step. As I've said, do your research, speak to experts, pitch your idea, and of course I'm available, very happy for you to talk to me if needed. I would just love to help. So that's the thing I'm most excited about, because I haven't really had that opportunity before, is to help and inspire other nurses.